Lieber Herr Professor Weyrich, vielen Dank.
Good afternoon. It's a pleasure and a privilege to address you this afternoon in the case of World Patient Safety Day. As you might be aware, the Organization for Economic Cooperation and Development has been involved in supporting the worldwide movement on patient safety already since 2017, when the first global summit on patient safety was hosted in Bonn. And we had the pleasure of producing a series of background reports under the label Economics of Patient Safety that can be used by policymakers and all actors to understand the magnitude of the safety problem and the effectiveness of the various interventions. From an economic perspective, the point has already been made that from financial sustainability, working on patient safety is a win-win situation. It helps to sustain costs, and of course it contributes to better outcomes. So the reports are actually much wider and cover things that were actually also addressed in the presentation by Bundesminister Lauterbach when he discussed the necessity of data sharing, digitalization, and the overall trust of the population in healthcare and what happens there. So an inclusive development and approach towards patient safety is key. And in that sense, it's a pleasure to announce that today, with the support of the German government, the OECD was able to release a new report on medication safety, but it's also a recognition of the inclusive development approach that you are having through your Aktionsbündnis Patientensicherheit, a way of different stakeholders working together to tackle the problem is the way forward. With that message, I would like to pass on to my colleague, Bienassis, who will be happy to share with you some of the highlights of the report that was released today.
Thank you very much, Niek. And thank you very much to the German Coalition for Patient Safety for inviting us to speak at today's meeting. We're very happy to be sharing the results of this report. The German Federal Ministry of Health has been a key partner and supporter of this work, which is the fifth in a series of reports examining different aspects of the economics of patient safety. The report, as Niek said, has been released today. So today in my presentation, I will be discussing the scope and context of medication safety, so that the cost to health systems, the uptake of interventions to reduce patient safety events, and recommendations from the OECD and steps that countries can take to minimize medication-related harms. Pharmaceutical consumption has been increasing for decades. This has been driven in part by a growing demand for treatment of age-related and chronic diseases, and as well by the evolution in clinical practice. Global consumption of pharmaceuticals has been estimated to be as high as 4.5 trillion doses in 2020. As the use of medicines has increased, so has the number of medications approved for use. Between 2009 and 2017, for example, US FDA approved 44% more new medications as compared to the previous period. These increases in pharmaceutical availability have converged with a number of demographic changes, including increases in the number of people living with chronic health conditions. These patients often have complex needs, including complex medication regimens that are needed to control multiple conditions. As of 2019, almost half of people over age 75 in OECD countries are taking 5 or more medications concurrently. This polypharmacy exerts a considerable burden on both patients and health systems. This is further complicated by the use of over-the-counter medications, which presents a challenge for health systems' capacity to ensure medication safety. Over-the-counter medications account for as much as 21% of pharmaceutical expenditure And almost 40% of people living in OECD countries have used an over-the-counter medication in the previous week. So despite increased awareness for medication safety over recent years, many healthcare systems still lack robust mechanisms to measure medication safety events. And so despite the development of and evidence to support effective interventions for improving medication safety, implementation varies widely and still can benefit from increases in scale. The scope of medication-related harms is considerable. As many as 1 in 10 hospitalizations across OECD countries may be caused by a medication-related harm, and 1 in 5 patients are likely to experience a medication-related harm during a stay in the hospital. Medication-related adverse events become more frequent as healthcare is utilized more commonly. Medication-related adverse events are common in primary and long-term care, but they're also commonly experienced within the hospital, as stated in the previous slide, and they increase in likelihood with each additional night of hospital stay. It's also common that medication-related discrepancies are experienced during hospital discharge. These hospitalizations not only de facto raise the risk of medication-related harm, but they also increase rates of polypharmacy. And with each additional medication, there is an increasing likelihood of a subsequent hospital readmission. Some patient groups are at higher risk of experiencing medication-related adverse events, including psychiatric patients and older adults. These groups are particularly vulnerable due to high rates of polypharmacy and difficulty in accessing coordinated care. Medication safety is an important policy area due to its impact on health spending, and there are significant opportunities for optimizing prescribing, improving adherence, reducing waste, and bettering patient outcomes. The amount of money that OECD countries spend on pharmaceuticals is substantial. Retail pharmaceuticals account for over 1/6 of healthcare expenditure in OECD countries and are the 3rd largest component of health spending following inpatient and outpatient care. This is in addition to hospital and over-the-counter pharmaceutical spending. Furthermore, out-of-pocket costs can be significant for consumers and impact outcomes and adherence. Using available research, we estimate that over 6 million hospital admissions annually are the result of adverse medication reactions, with the aggregate cost of avoidable hospital admissions due to medication-related harm totaling over 51 billion US annually across OECD countries. In addition to this, every year, there are more than 1 million hospitalized patients in OECD countries that experience an adverse medication event in hospitals. This costs countries an additional 3.4 billion in unnecessary hospital days. The role of health information infrastructure in these processes for improving medication safety are key. This was one of the main topics of a recent survey conducted by the OECD on assessing the adoption of systems and interventions to improve medication safety, where we looked at the scope and use of pharmacovigilance systems, drug utilization or DUR systems, and other medication safety policies and interventions. A DUR system is one that collects information on the volume and type of medication use, and the quality, granularity, and linkage of this data with other databases determines the extent to which it can be used at the clinical level to improve the quality of care. This data is also valuable for regional and national administrators for monitoring and identifying patterns that may require an intervention. 70% of surveyed countries have systems in place to conduct drug utilization review at the national level. Most countries report that information on prescribed or dispensed medicines is available via their national system. Fewer collect information on dosage, duration, and indications of prescribed and dispensed medications. The majority of responding countries note that the data used in the drug utilization review system are derived from claims data. However, an increasing number of countries also utilize data from e-prescribing systems. 3 countries, Australia, Japan, and the United States, indicate that EHR, electronic health record data, is accessible via their DUR systems. The ability of DURs to be linked with other key data sets is important for producing meaningful information for providers and policymakers. A number of countries are able to link their DUR systems with data on hospitalizations, mortality, diagnostics, and health outcomes. And a more limited number of countries are able to link their DUR data to adverse medication event reporting. Finally, timeliness of the data available in these systems is another key characteristic that influences the usefulness of its usefulness for policymaking and clinical use. And 7 of our surveyed countries note that the DUR data is available in real time. Beyond the structure of DUR systems, there are variations in how these systems are used to improve safety and optimal prescribing practices. For example, by providing individual prescribers feedback, being used for quality improvement, or for other policy purposes. Most commonly, DUR data are used for reimbursement coverage decisions. However, a number of countries are using DUR data to drive quality improvement in healthcare delivery as a mechanism for providing clinicians and prescribers with feedback, including, for example, being used to provide real-time dispensing decision support for pharmacists, or as a basis to facilitate interactions with clinicians and pharmacists. In terms of quality improvement, countries use DUR data for both informing local practice guidelines and for clinical guideline development and evaluation. 8 countries use DUR data to inform practice performance quality indicators, and 3 use the data to inform audit studies. Our survey also looked at the adoption of a number of other digitalization and medication safety initiatives that could be adopted to enhance medication safety outcomes. There have been a number of innovations in digitalization, such as smart infusion pumps, automated drug administration systems, or e-prescribing, as well as data infrastructure, such as patient reports of medication-related adverse events, post-market surveillance systems, EHR capacity. And these all have significant potential for improving medication safety at scale. However, we see that systematic uptake of these interventions is generally lagging. For instance, only 4 countries currently have implemented national programs to use barcodes to track medications for administration. To date, most of the digitally related interventions have been adopted by countries only in selected care settings. Patient and prescriber-focused medication safety initiatives, particularly prescriber access to a patient's past medication history and public education campaigns, have been well adopted by OECD countries at the national level. Adoption of systems-level interventions, such as national lists of high-alert medications, can guide healthcare leaders in the implementation of safeguards to reduce the occurrence of medication errors and adverse events associated with the incorrect use of high-risk medicines. And these have also been widely adopted at the national level in OECD countries. Less adopted are novel adverse event reporting techniques. For example, only a limited number of countries currently report having national systems for non-voluntary reporting using trigger tools, but a number of countries report using these types of tools in selected healthcare settings. Overall, based on our survey findings, we see that OECD countries have made significant progress in implementing functional tools to monitor and assess patient safety. But the next frontier is operationalizing data systems to make these systems safer in real time. A number of countries can be looked to as leaders in this field, and their health information infrastructures can be viewed as a roadmap for improving medication safety. In addition, the environment caused by the COVID-19 pandemic, where countries are working to rapidly update their national data infrastructures, provides an opportunity for improving the functionality of data for monitoring medication safety in real time. For instance, the COVID-19 rollout demonstrated the importance of real-time information sharing, open source data repositories, and strong communication systems to identify, investigate, and respond to rare adverse events. These trends are important steps towards strengthening pharmacovigilance systems across OECD countries and globally, and a path forward for improving medication safety outcomes. Governments can continue to build upon these gains so that health data systems are high quality, interoperable, and that they can integrate electronic health records with information on patient diagnosis and outcomes with pharmaceutical information, using this information to meaningfully identify at-risk patients. Another area where countries can work is to invest in person-centered medication and addressing the behavioral aspect of improving medication safety outcomes. Investments should continue to build systems that capture patient experience of medication-related adverse events and medication side effects. And these have been increasingly adopted in a number of OECD countries. It's also key that patients have access to their medication histories and integrated care that accounts for their medication needs and safety. Finally, capitalizing on COVID-19 related improvements in access, there are opportunities to expand the role of pharmacies and pharmacists in the clinical care team, if done safely. Pharmacies have begun to serve as the first point of contact for patients in many countries, allowing for improved access of testing and vaccination. In many countries, pharmacists have also taken on new roles in renewing scripts and helping patients access medication. Related, e-prescribing systems generate valuable data for use in drug utilization review, which can be then used to enhance prescriber feedback mechanisms, information to patients, or to advise policymakers in real time as to trends about prescribing practices. Linkages with electronic health records are the next frontier, where together data from e-prescribing and EHRs can be used to monitor outcomes in almost real time to enhance safe medicines use and rational use of medicines. I'd like to thank all the countries who participated in generating information for this project, as well as all of the experts that provided inputs as we developed this work. Again, I'd like to thank the German Federal Ministry of Health for the support of this project, as well as the German Coalition of Patient Safety for the opportunity to present today. Thank you very much.
Dear colleagues from the OECD, thank you so much for sharing those valuable informations and numbers from the report with us. You had some good points there which already our health minister from Germany addressed. I'm just saying two, which is like the real-time data information and data which has been collected from the health record. But that is an issue in Germany. We have to keep on going there. You enhanced us with this information, and the information is retributed to get more into the discussion later on. We thank you so much that you have been our guest, and we honor that you spent the time with us. Thank you so much.